Naruvi Hospitals, promoted by the Sanko Foundation, is the brainchild of the founder-chairman Dr. G.V. Sampath. Belonging to Vellore, the medical hub of India, Dr. Sampath's vision to create a medical destination for the people of Vellore in particular and others from India at large and also overseas resulted in the establishment of a hospital here, a real crown jewel in the field of healthcare. Large numbers of people belonging to Vellore and the surrounding districts have been known to travel to Chennai and Bengaluru, both nearly 200 kilometers away from Vellore, seeking medical care due to the dearth of facilities and the hardships faced by the locals to access available services. As per the vision of the chairman, the best in healthcare, both in terms of medical and nursing professionals as well as sophistication, were infused into the institution, making sure that patient affordability was addressed at all times. Less than a month after Naruvi Hospitals opened its doors to the public, the second wave of COVID loomed large as life. We took on the challenge and quickly rose to the occasion, catering to the local population and some from outstation as well, adding close to 40 critical care beds and over 200 ward beds to the COVID care pool. Much as it was hard for a 1-month-old hospital to handle such large volumes of very sick patients, Naruvi Hospitals was able to contribute significantly in our country's efforts to save people from the disastrous end that COVID was driving people to. Naruvi Hospitals is positioned as a high-end tertiary care center. Our focus on ethics, transparency, patient satisfaction, and an academic outlook in everything we do ensures that doctors, nurses, and others in the care team are performing at their conscientious best to not only treat patients' ailments, but also to make them happy overall when they leave our hospital. We have tied up with the Henry Ford Health System, HFHS, based out of Michigan State in the United States of America. HFHS is one of the old and leading healthcare delivery systems in Midwestern America. The main aim of this tie-up is to have constant transfer of knowledge and to get access to the time-tested practices they have been following for decades, which ultimately translated to patient care. Naruvi Hospitals is a completely paperless and filmless hospital. The Naruvi philosophy of care is embodied by our motto, Fragrance of Care. The doctors in Naruvi are largely trained in the best of medical institutes in India and come with years of rich experience in their fields of expertise. With the philosophy and its pallbearers, the medical and nursing professionals, the high-end equipment, and the building infrastructure complete the holistic picture of Fragrance of Care. The hospital is 475 bedded with a 25% critical care bed count. Naruvi Hospitals boasts of an over 5 lakh square foot building spanning 14 levels. The building is completely air-conditioned, conforming to ASHRAE standards with zone-specific air conditioning to reduce cross-infection between different care areas. Our laundry is 100% barrier washed. We have a top-of-the-line sterilization department with machines with 95% water-saving machines, saving up to 300 liters of water every running hour. We have all the major medical and surgical specialties. There are 16 modular operation theaters with laminar airflow. All the equipment in the ICUs and OTs are pendant mount to avoid clutter on the floor. All the departments are equipped to the most modern standards with the best and latest equipment so as to be able to provide the best end-to-end treatment to our patients. State-of-the-art cardiac cath labs, the latest robotic hybrid OT, ECMO, interventional pulmonology, high-end orthopedics, general and bariatric surgery, epilepsy monitoring unit with robot-guided epilepsy surgery, neuro monitoring, navigation, the latest lithotripter, urology laser are just some of the arrows in our quiver. Our primary focus, though being the local Velo people and Indians at large, we are working towards attracting overseas patients as well. We have started an office in North Sudan in Khartoum. We're in the process of tying up with the governments of Oman and Seychelles as well. In all, Naruvi Hospitals is more than a hospital. It is an experience.
Good morning, everyone, and welcome to a webinar hosted by Naruvi Hospitals and The Hindu on ENT care and concerns, myths versus reality. My name is Yashaswini, and I will be your moderator for the next hour. Thank you very, very much for joining us on a Sunday morning of a long weekend for what promises to be a relevant, timely, and necessary conversation. Through the course of the next 1 hour, we are going to address questions around dizziness, snoring, ear infections, hearing loss, and so much more. Subjects that affect each and every one of our lives in some shape or form, sometimes even every day. We have an eminent panel of doctors here with us today to debunk some myths, explain some realities, and answer many questions. Before I go ahead and introduce our panel to you, a few caveats and announcements. Please use the question answer box at the bottom of your Zoom screen to post any questions that you may have. We look forward to spending the most time today answering your questions and would love to hear from as many of you as possible. If you are joining on your laptop, the button should be at the bottom panel. If you're on your phone, click the three dots on the bottom right and you will see it on the menu that pops up. And finally, while we do our very best for a smooth webinar, please be patient in case of any technical difficulties and be assured that we will be back as soon as we possibly can. And with that, it is my absolute privilege to introduce our panelists for today. Professor Mary Kurian is presently the Senior Consultant and Head of ENT at Naruvi Hospitals in Vellore, Tamil Nadu. Dr. Kurian had been a member of ENT faculty at Christian Medical College CMC Vellore for over 3 decades, where she retired as professor and head in 2015. Prior to joining Naruvi, she was professor and HOD of ENT in Pondicherry Institute of Medical Sciences. She has international work experience as well, being senior ENT consultant in Australia, Brunei, and Oman in the past. She did her MBBS from CMC Ludhiana and MS from CMC Vellore. She has received fellowships from the University of Graz in Austria and Pennsylvania in the US, Johns Hopkins University and Stanford in the US, and Great Ormond Street Hospital in London. She has over 80 publications in peer-reviewed journals and most recently has authored a chapter in an undergraduate ENT textbook. In 2020, Professor Mary became the first Indian to be conferred as international member of the prestigious American Society of Pediatric Otolaryngology. Dr. Preeti Mary is a consultant in the Department of ENT, Head and Neck, Vestibular Medicine and Cochlear Implant Services, Medical Trust Hospital in Kochi. She graduated from Kottayam Medical College, did her post-graduation from Trivandrum Medical College, and was also awarded the International Online Vestibular Diploma in February 2021. Dr. Preeti has a special interest in vertigo and balance disorders. She was the former secretary to the Association of Otolaryngologists of India Cochin chapter and secretary of the Cochin Society of Otolaryngologists for Medical Services. She has also acted as the organizing secretary for multiple conferences, including the Kerala State ENT Conference in 2018. Our third panelist for today is Dr. Nadia Faisal. Dr. Nadia did her undergraduation from the Thrissur Medical College and master's in ENT from Kasturba Medical College, Manipal. Dr. Nadia was awarded Manipal University's gold medal for the best postgraduate student at the postgraduate ceremony. In addition to being an excellent academician, Dr. Nadia is an exemplary clinician. She has 7 years of ENT experience and currently works as consultant ENT surgeons at Naruvi Hospitals. Over the next few minutes, Dr. Mary will be speaking to us on everything around throat and ear infections. Dr. Preeti will address giddiness and hearing loss, while Dr. Nadia speaks about nose-related concerns and snoring. Please don't forget to keep the questions coming. We are very excited to hear from you. And with that, I will hand over the virtual mic to Dr. Mary to get us started.
Thank you very much, Yashashwini. And I think I will start with my slides right away. 1 minute, I should go to the first slides. I'm sorry, we'll just start with that. Yeah. As the topic says, I thought maybe the best way to start will be just give you some idea. I'm sure most of you do know, still revise what is ENT and what systems it contains. ENT actually stands for ear, nose, and throat. It sometimes, and in professional circles, they also use the word otorhinolaryngology. As the picture shows, we have a ear, nose, and throat outline, but there's something more to it. Looking deeper, you realize why these specialties came together. You have the nose, which is connected to the ear. You have the nose, which is connected to the throat, and the throat connected to the voice box. So it is supposed to be a small specialty, but a very complex one. So starting on that, just allow me to say a few words about the ear, probably ear and throat. I'll just outline. Just looking in this, all of you know, we have an outer ear pinna and a canal and a membrane, tympanic, some small bones. This is called in the middle ear and an inner ear. This is, and just look at this long tube. That is the connection to the throat. And if you look, I have not shown in the picture, but the inner ear has nerves letting you into the brain. All above it's connected to the brain. And you have all around the ear lots of nodes which tend to swell. So that's about the ear. Now, what all? It helps us to hear, right from outside, catching the sound, making the bones move around, then making the internal ear fluid move around and make you hear. It also helps in hearing. But what can go wrong in this passage? Most of all, you all come to us is pain in the ear. So one would wonder, what can it cause? Anything in this passage getting stuck or swollen or infected can cause pain. That is the commonest. If you have pain in the outer ear, you can have swelling, severe pain, severe swelling around the ears. Sometimes you can't hear. It's more of a blocked. But if you have some infection in the inner middle ear, that generally does not cause much swelling, but you'll have hearing loss, but severe pain. But many of them can have, as simple as the picture shows, it's connected to the nose. Generally, they will have a nose block or discharge or sneezing or infection a few days prior to it. So that is it. Many a times we really cannot see. There can be changes on the drum, which is normally pale. It might look red and swollen, but you may have to have a sense of looking deeper or thinking about it. Another thing, if you don't treat it, it can go to the brain. It can come out to the bone. So other than pain, they can also have discharge, fever, and other signs of complications. Many a times, probably don't take it too lightly. But other than this infection, many of you say, I always think it is wax. Yes, wax can cause pain when it is stuck or it is, covering the whole canal. And I'm sure many of you would have tried to clean also. You will wonder, why do we need to clean? No. See, wax is, the skin is falling out and it is naturally made that way. It will come out by itself. Do not clean. So few other questions. I just put this outline so that you can think of the questions to ask about the ear. About the ear, much more than what I'll say now. Let me just say a few words about the throat also. If I know all of you, the minute you say the throat, you'll say, yeah, we open our mouth and we see, all of you have seen the mouth, the you have a small tongue, we call it the uvula, then something in there. Sometimes in this picture, the tonsils are not big, but sometimes you'll say, sometimes the tonsils are big, sometimes they are not big. Yes, the young children will have the tonsils big because it helps to bring your immunity, help them to counteract the common things in the environment and get over the infection by themselves. However, many times it comes with throat pain. Then I'm sure even then you will look at your throat in the mirror and say, yeah, I can see my tonsils red, angry, white patches. And I'm sure you all have seen this many a time to yourself or on your home people. Yes, that is when it causes infection. Infection, most of them you'll ask, oh, I think I have tonsillitis. Many a time you're right. But always remember what is behind and in around the throat. We have behind, the eating passage. In front of the eating passage, the breathing passage. So many a time the throat pain, if you know, it can spread behind to the neck and the eating passage symptoms or breathing passage symptoms. So that's one thing you have to be just generally aware. Sometimes along with throat pain, they can come with a swelling neck. Let's not wait for that. Now you can ask me, so all throat pains have to be gone to a doctor? Generally, when there is throat pain with mild fever, we call it tonsil or pharyngitis. Pharynx is tonsils are situated in pharynx, one part of pharynx. Generally, they are virals. And viral infection, if you're not a vulnerable, like the very old or the very young or a person who have diabetes, they will get over it or any other illness. But if they don't, it's when you go to a doctor, when it's maybe more than 3 days, or throat symptoms of eating difficulty, breathing difficulty, swelling neck comes up, then you go and you think, yeah, it may be more than that. So that's about throat pain. Many a times throat pain can be by itself with fever, but if it goes beyond the throat is when you start having symptoms of other than that, breathing, eating difficulty, painful swallowing. So many a times we also have, I just put in 2 questions because many patients do come. So, doctor, I have throat pain. And somebody said, I have to get, can you tell me? Or, doctor, do I have cancer in my throat? So this is another. So I think I will stop with that. And each of you heard it, think whatever you can, right? And ask your questions, we will move on. And I think I have to say a little, I say of the hearing? Yes, the inner ear does cause hearing loss. And along with hearing loss, inner ear also helps us in our balance. So I will give on to Preeti to say a little more of that. With that, I finish my talk at this presentation. Thank you very much for your patience. Over to you.
Thank you, Professor Mary. I think all of you have heard such a exhaustive, it shows her prowess as a professor and somebody in a teaching profession and in the specialty for a long time. So kudos to ma'am. So I think I don't have any slides to start with. And, when you all talk about Panjendriyas or the 5 senses, you all are familiar with that. And I think as ENTs, we could actually boast about at least taking care of 3 of those senses, the hearing, the sense of smell, and the taste. And we have recently included another 6th sense. And it's not the 6th sense that you're thinking about, but 6th sense is otherwise the balance or the sense of balance. So that way we deal with at least 4 senses. So if you ask me, which is the best of the senses, I think all 3 of us will be biased and we will say it's hearing. So don't take our opinion. But you all know about Helen Keller. She was a very famous, prolific author, and she was a born normal child and later on became deaf as well as blind. And she has actually mentioned once, if I have to be born again and if I have to choose between blindness and deafness, I would choose to be blind rather than deaf. Because, blind get all the sympathy. The blind separates you from things. But whereas deafness ostracizes you in a society, it separates you from people. So hearing is something which is very crucial for our existence as a human being in a society. So be it whatever age, if you're a young child, if you're a born deaf, or as you age, everything, the hearing is very important to be a part of a useful member in a society. And remember, this is probably the only sense which can be restored as of now with the technological innovations like cochlear implants, especially if a child is born deaf. And this is the only sense which we humans can restore at this particular moment. So we have a lot of options in the treatment of deafness. It could be just infections like Dr. Mary pointed out. It could be so many other things. So you could all possibly think about the questions that you would want to ask us. And another topic which is very close to my heart is probably balance disorders or vertigo. And I'm sure post-COVID, we have actually come across a lot of people with balance problems. And this, again, is another problem which starts probably by middle age, most commonly. It can happen at any age, but probably most commonly at middle age. And balance and vertiginous problems do create a lot of insecurity for a person. If you talk about hearing, it is kind of an ostracizing from the society. Whereas a balance problem is something which you cannot show somebody unless you're tending to fall down. It could be just a sensation of swaying. It could be something that you feel, or it could be your fear of falling. And most of the time, a patient is not able to convey his problem to a doctor, and it's probably not addressed as well because it's very difficult to convey what you feel. And it's more of a subjective sensation rather than, you have a blood glucose which is 200, it shows, okay, you have diabetes. But it's in a balance disorder, it is very difficult to put it across to another person what you feel. So I would be happy to take all questions regarding any of this. And I think I will pass on the mic to Dr. Nadia. Thank you very much.
Good morning, one and all. It's almost noon. Thank you at the outset to the Hindu team and Naruvi Hospitals for giving this opportunity once again. And I would like to thank Professor Mary for initiating the talk and giving quite a bit of details about ear and the throat, and Dr. Preeti for touching on balance and hearing. So I also would like to just go through a couple of concerns that we see on a regular basis in our OPDs, which patients usually come across, and so that we can probably bust some myths which may be running in people's minds. So just a couple of minutes, and then we should be able to take queries. So first things first, one of the common concerns people come to OP is saying, I have allergy. So they're self-diagnosed. Everybody knows it's an allergic reaction. Maybe known allergen. Allergen is something that causes allergy. So could be something that they know, like dust or pollen or some kind of food or some medications. But allergy per se is a kind of hyper reaction of the body. The body is hypersensitive to certain particles, which the person next to me may not face. So that's what allergy is, and the patients usually know what it is, and they come to us saying, I have allergy. So we almost diagnose with the common symptoms. They say we sneeze as we wake up in the morning, we have bouts of sneezing and runny nose and itching of the nose and the throat, and it's the usual concern, and people know. But then what concerns them is that it's not treatable. They would have heard from outside that it's you got to live with this, it's not going to go away. So that's not the thing. I would like to say that allergy is definitely treatable. I tell my patients nearly half of it is avoiding the allergen, and the rest half we take care with medications, not lifelong for sure. And within a couple of months, or depending on your immune response, your hypersensitivity will come down, and then you're back on track with sometimes SOS medications whenever you need. So allergy is treatable. That's one thing I wanted to tell. The next common concern people come and ask me is, do I have a sinus? Of course you do. All of us have sinuses. So that's the way it's perceived, that if I have a sinus, I have an issue. So we all have sinuses. Sinuses are, in simple terms, spaces within the head which kind of helps ventilate the nose, and it has other functions like making the head light and all that. But when sinuses accumulate mucus or phlegm, or certain reactions happen within the sinus because of some blockade of the drainage. So there is the drainage through the nose, which happens for all of us, but some people are prone to sinus infections when there's collection within the sinus, and then there is lack of drainage. That's when we have issues. So patients usually will know, because they have a pressure feeling in the head and that heaviness, and a lot of phlegm coming through the nose, and most of it going to the throat and giving them a cough which doesn't settle for days. And it's very typical. So again, patients come and tell us that it is a sinus, but we need to know sinus infections and allergy are separate, but allergy can lead to the other. And again, very much treatable, may not require surgery. So it's in the early stages. We can do a lot of trick with medications. So it's not really something to be worried about. We can deal with it. Is the panacea the only remedy? Is antibiotics is what the general concept is? It's a complete no if it is not a bacterial infection. So sinusitis directly equating to antibiotics should not be the case unless a bacteria is involved in the etiology. That's not the thing. We have a lot of other measures to drain the sinus, decongest the nose, and it takes care of it most of the time. Or if it's a viral infection, it's just a course of 1 week of symptomatic measures and you're good to go. So antibiotics, self medications are to be discouraged. Yeah, many patients come to me asking how do we prevent that. So as the old saying goes, an apple a day keeps the doctor away. May or may not be, because there are some, again, probably grandmother classified hot versus cold foods, which I don't completely disagree from a perspective of each individual, but scientifically there is no basis to the hot cold food. Some bodies may not respond too well to certain foods or fruits or vegetables. That doesn't mean we have a blanket statement labeling fruits as hot foods or cold fruits or whatever and avoiding them. So each fruit or vegetable has their own nutritional value, and put in together, probably they will keep doctors away. So I would like to just say that it's not the right thing to avoid all fruits or vegetables. Another concern with which patients get alarmed is nosebleeds. So it's not a simple thing that blood is pouring out of your nose, even it be a drop or two or even half a cup. It's a concerning factor. So what traditionally has been taught to us is, when you have a nosebleed, sit back, recline yourself, or even lie down till it stops. That's not the thing to do. In fact, it's just the opposite. You're supposed to lean down and pinch your nostril, so that anything that blood flows out through the mouth, and you have to spit it out, and you have to keep your mouth open. So absolutely not lying down, because that can cause a complication called aspiration. It can just slip into your airway, which can cause devastating results. So what do? You tilt forwards, absolutely not backwards, pinch your nostrils, the soft part of your nostrils, for a couple of seconds, maybe 30 seconds to a minute will do the trick, and keep breathing through the mouth during that time. And once it's all settled, probably an ice pack covered, wrapped in a thin cloth or something over the nostrils will help, and seek medical help. Do come to us if you have an issue. Another concern, my nose is not sensing as it used to earlier. So that is called hyposmia, or sometimes, absolutely no sense of smell, and that leads to kind of non-appreciation of taste also. So this is another concern we see in the outpatient department. And one of the major victims, or the culprit, is our own dear, not so novel coronavirus. Any viral infection for that matter can cause some, mostly temporary, I say mostly because there are still studies going on, but temporary damage to the olfactory nerve, the nerve which sends signals to the brain. to perceive smell. So again, we need to look into the causes. There are many other causes, so it's not just the COVID, but we need to evaluate, look for any signs of sinusitis or nasal polyps or something which are treatable and easily reversible, or we need to look for the causes and probably we can give you an idea about that. Another interesting, well, not so interesting for the spouse, concern we see in the outpatient department is snoring. But the thing is, everybody, when we look at a patient, we kind of get to know whether they probably would snore by the BMI or the general this thing of the patient, the looks of the patient. So when we give leading questions, they say, yes, we do. And it's a normal thing. Everybody snores. So yes, snoring may not be a concern in all patients, but if you're a chronic snorer and there's a lot of loud breathing and you have spells of waking up in between, which we call apnea, which is because there's not enough oxygen reaching the lungs, then that is of concern. So maybe you wouldn't have noticed, but your spouse or whoever sleeps with you would have noticed. So if these certain symptoms which are really for concern are there, then we need to check what is wrong. So basically, snoring in easy terms is loud breathing when air passes through the nose, through the back of the nose to the throat, and then to the windpipe and the lungs. Anywhere along the way there is some obstruction or some partial block, then there's turbulence in airflow, which causes that vibratory sound, and then it causes the snoring. So it's not alarming. I don't want to scare anybody, but there are certain things which we need to evaluate if you have a lot of spells in between, or you feel sleepy in the daytime because you probably wouldn't have slept as well as you need to sleep, and you have disrupted sleep. So you sit at the system and you're working, and then you feel drowsy, or you're driving and then you feel suddenly sleepy, or you're sitting waiting for something and then you feel sleepy. All these are certain subtle signs which we could evaluate and let you know if you really need to undergo tests. So I think I just wanted to brief about a couple of things. I would like questions from everybody so that if we could clarify anything. Thank you.
Thank you so much, doctors. What a all-encompassing set of presentations, so much information in less than 30 minutes. I think there's a lot to think about, a lot to talk about, a lot to ask. We do have questions that have started coming in, so I'll dive right to it. Some of them actually takes off from some of the things that you already brought up, Dr. Mary, so perhaps we can start there. You spoke about earwax, cleaning the ears. We have a question from Satish Kumar talking about why does earwax form, how to prevent it, and if you can also talk about how often should people be cleaning their ears.
First question, thank you for asking, why do you have wax? Wax is a normal phenomenon because the canal is lined by skin, and all of us shed our skin. And like the ear also sheds the skin. But in the growing child, sometimes because they're growing, they shed more. And many a time, and the second question, then I'll answer together. Second question, how do we clean? Our creator has created in such a way that you don't need to clean it. The earwax or the skin normally migrates out of the canal by itself. Sometimes people have a little narrow canal. It may be a little slower. That time it can block, but on the whole, not always. But people tend to think we have to clean, just like you clean your face twice a day, once a day, or once in a week. The minute you clean, you're doing two things against nature. Number one, you are making more wax created, more of shedding because you're stimulating the shed. And then you're pushing inside whatever it normally has come out. So if at all, once in a way you feel a discomfort, check whether the wax has accumulated, and then you can soften it and remove. Usually we can try Nadia, it was Preetya, one of them said, a grandmother's technique. Normally in the very young or the very old, if they have wax, what we give, that I have been giving is, tell them to boil and cool the oil, coconut oil. When I worked in Oman, it was boil and cool olive oil. In fact, the hospital used to dispense them for the very young. Put that 2-3 drops. 2-3 drops, 2-3 times a day. As you could bend your ears to the opposite side, cup your top of the ear. So, and gently, we call it the displacement, gently, so that it soaks in and lie on that side for about 5 minutes. Do the same. And usually it softens and come out. We have got available drops, that softens and reduce the pain. We can give it wax or Solivax. That is for the, but generally for the question, you don't have to have a routine. Johnson's butt is something they say, take it off. It's meant actually for the little ones in the crevices in their external pinna and all for cleaning or behind, not the canal. I hope I have answered.
Thank you, Doctor. Important myths being busted. Our next question, perhaps Dr. Preeti, you can take this. Very relevant to the world that we all live in and the kind of days that we have. But lots of questions about safe volume levels for Bluetooth earphones. Does overuse of earphones cause deafness? Just if you can address earphone use, given I'm using them now. So
Unmute.
you're on mute, Doctor. Sorry.
Yeah, I think it's a very common questions from the youngsters, because everywhere we look around, they are all with earpods or Bluetooths or even headsets and all those things. So if you are asking me medically, we measure in decibels. So you have a sound intensity levels. So if you ask me if you're exposed to a sound, say more than 70 or 60 to 70 to 80 decibels for a long time, say maybe 6 to 7 hours or 7 to hours more than a day. Like there are people working in engine rooms, there are people working with machinery, there are people working with, listening to music in a high volume for such a long time, that can produce a hearing loss. And even single intensity sound. So if you have a hearing decibel, say, intensity of sound more than 120 decibels, a single point, that can also produce a hearing damage. So the bottom line would be, the simple thing I would actually tell the youngsters is if somebody sitting very close to you can hear from your headset, that means you are loud. You have to turn down the volume. And most of the devices that we have now, they actually give a warning when your sound levels go above that. So heed to those warnings. And though as much as we like to hear things loudly, this on a long time or on a long term can produce hearing damage. And if you ask me about the studies, because these are all quite new things, all the studies are just coming up. But like somebody said, like grandmothers say, too much of anything is not good. So always restrict the sound levels. If we are using a headsets or a earphone so that it will not be a disturbance to another person. So don't use it to a level that will damage your hearing. I hope I answered that question.
Is there any follow-up from one of the questions, actually? Is there any recommended volume level? Are there any hard and fast rules that people can follow?
No, there are no hard and fast rules, but it should generally be below 70 decibels. So when you say 70 decibels, the common sounds that you would hear would probably that of a washing machine that is running on a full thing. So that is the level of sound that you're talking about. So if you're going to listen to music or if you're going to use a headset for a long time, turn down the volume to the level that you can just hear it well. It doesn't have to be very loud.
Sure.
It's no single levels, and most of your systems would have a warning levels if it goes beyond the recommended levels.
Got it. Thank you. Dr. Nadia, some questions about more common ailments. How can we stop snoring? How can we stop severe colds with runny noses? If you'd like to take those two.
Sure. So stop snoring, again, like I was mentioning, you need to know the cause for snoring. So children may have snoring because they have some obstruction in the back of their nose, which is commonly called adenoids, which is a counterpart of the tonsils, which Dr. Mary was telling us about. So there are a lot of lymphoid, that is immune related organs in the body in children till they pick up to their adult stage. A lot of these organs are very active and they are bigger than usual. So in children, you need to assess if they have these causes for snoring. So basically anything that blocks the airway causes snoring. So we need to look for the cause and then help in snoring. But generally, For anybody, if you have a well-maintained body with a good BMI, you're not overweight or obese, and you don't eat just before you sleep and you lie down on your sides. But if you have any real causes for the snoring, then we have to get it evaluated and cure you. So keep a check on your weight, and make sure you don't take a heavy dinner just before your sleep is a couple of easy tips to kind of avoid. But if you still have persistent snoring, then you need to look for the causes. To prevent regular colds, of course, like I mentioned, take a good diet. Vitamin C and vitamin C rich foods are quite good. In the contrary to, generally people say lemon causes cold. So I kind of keep telling my patients it's not so. So take a good, healthy, balanced diet, wear masks when you go to crowded areas, because during COVID, a lot of our allergic or, the recurrent flu kind of symptoms came down just because everybody wore masks and followed some kind of hygiene. So apart from that, if you have an allergy, avoid the allergens, and make sure you don't go to the dusty areas, keep the house clean. Pet exposure also can trigger. So couple of things which is not one size fits all. It's tailored for different people, but yeah, make sure you take a balanced good diet.
Thank you so much. I think our next set of questions can be shared between Dr. Mary and Dr. Preeti. Lots of concerns coming in about tinnitus and ringing in the ears. What are the causes? Does it affect balance? How can we prevent it? Can we live through it? Can we do anything to make it better? If you can just speak to some of that. Dr. Mary, why don't you start, and then we'll go to the balance side of this.
So, I mean, these are, like you said, very uncomfortable symptoms. So actually, some of them, when somebody comes with a sound in the ear, we do tend to ask them, does it happen always, or does it come and go? Is your sleep disturbed, or your life, you're really troubled by it? And actually, what from now in my experience, there could be, if you find nothing that eye can see, like, no wax sometimes can cause the wax sitting on the drum, or some middle ear infections generally do not cause sound unless it enters the inner ear. So if you have a patient with a discharge and now then the sound, then you get worried, is it inner ear affected? However, if you can't find anything, we would think, is there something to do with the blood supply to the inner ear? So we tend to think, is he hypertensive? Does he have cholesterol? Does he or she have sugars? So this is how we tend to check all that. And suppose, and we do a hearing test, my dear, I forgot. When we do a hearing test, if there's some doubt, there is an asymmetry, that is, one ear can't hear more than that, then you're worried. So these are actually different levels. So unless we try to, we try, when you come, we first do the audiogram from an ENT point. But if the patient goes to a general medicine, they will first do all these symptoms and then send to us. So unless we rule out finally in the end, we may not find anything as well. Then what you do, it is, I think Preeti will be able to tell that better than me.
Yeah. So, see, tinnitus, or what we call is the sound in the ears. It's very closely related to our hearing as well as our balance. There can be, like Madam rightly said, there can be umpteen number of reasons or thousands of causes for producing the sound in the ear. And I always tell my patients, it's like, you have an analogy with a headache. You have thousands of causes for a headache. Okay, it's like just like a symptom. And you could have very trivial causes like, you didn't sleep the day before. And you could have very serious causes like, you have a brain tumor. So similarly for a tinnitus, it could be just as trivial as a little bit of wax, like Madam rightly pointed out. And again, it could be anything major, like, you have a major blood flow problem, or you have some tumors or some mass lesions in the brain, which is pressing on that nerve. So you have such a spectrum of problems that can be due to, that can bring out the symptom of tinnitus. But again, there is no need to panic or worry just because you have a little bit of ringing in the sound, because the common things are always the common things. But again, like Madam said, if you have a hearing loss or a balance problem associated with that, we need to check further. And again, the first line is always an audiometry. And that is basically your hearing checking. And if you find a hearing loss on that side where you have this tinnitus and you have a balance problems, there are a couple of disease conditions. Like we say, Meniere's disease. Meniere's disease is something which can have a triad of these symptoms. And this is probably one classical presentation. And it starts with a little bit of ear block, little bit, a lot bit of tinnitus, and then you have a spinning kind of a vertiginous sensation. And this can occur over years. It can be episodic. So when you have a hearing loss with a tinnitus and with a vertigo or a balance problem, it has to be evaluated. It could be Meniere's, it could be some ear infections. There are certain ear infections which can erode, which can actually, there can be a little bit of bone erosions into these balance canals or the semicircular canals that we call it, and produce all these symptoms. So it could be just an infection. It could be something to do with the pressure or something, very simply put, some increased pressure in the ear, which produces this Meniere's kind of symptoms. It could be even as worse as having a tumor in that area, which is pressing onto these nerves also. So when you have all these symptoms together, it is always better to evaluate. And again, certain trivial problems, like, you have a migraine, and there is a variant, we are all familiar with migraine, you have headaches, that is something which the public is mostly aware of. But there is a variant of migraine, which is called as a vestibular migraine, because it presents mostly with balance symptoms. So in that condition also, you can have a little bit of tinnitus in the ear without a hearing loss, mostly, but it may be a little bit of minor hearing loss, but again, with a balance problem. So it could be just trivial as just as a vestibular migraine also. But if you're having a tinnitus with a balance problem and with a hearing loss, it is always better to get it evaluated.
Does prolonged headphone use cause dizziness? Lots of headphone questions coming in.
I guess it's the youngsters. Well, we don't have much studies on that, but then, prolonged usage, it is not probably just the sound or about the earphones alone, your positioning, you are going to be, there are so many people working on the computers right now, sitting at the system. If I have got the liberty to say, that is probably one of the worst postures that you can get every day, sitting at the computers for 7 to 8 hours, When you talk about a person's balance, you have a lot of inputs from your vision, from your inner ear, and from all the sensors, from your neck, your joints, and everything. And when you're sitting with a system or sitting with a computer for a long time in a particular position, it can affect all your cervical muscles, postures, all those things, which can affect inadvertently on your health. So not only just the use of earphones alone, not only the volume of the earphones alone, your sedentary lifestyles, your postures, your neck pain, all those things can contribute to your balance or disease.
Thank you, Doctor. Dr. Nadia, some common concerns / home remedy questions coming in. What remedies would you suggest for headaches after washing your hair, for polyps, both?
Again, very common for us. So head baths, I tell the patient, what is your head bath routine? Please go ahead with it. So we say, back in Kerala, I belong to Kerala. So we say we all take head baths every day. We are used to that and we don't get a cold every day. So it's the person, how the person takes it. So if they have a routine, please stick with the routine. But if they always get a headache after the head bath, find out if it's related to a cold. Find out if it has any other triggers, because if it's a consistent pattern, they would know what the trigger is. So if it's just the head bath and they feel heavy in the head and all, could be something to do with a sinus issue. So dry the hair well, and make sure that you're not exposing yourself to too much of cold or whatever. So I tell patients, when you have a cold or a throat infection, don't take cold water. But it's not that 365 days you're not supposed to take cold water, because all your bodies don't respond in the same day. So similarly, head baths, go ahead if you're fine with it, even twice a day. So really, it's your body that could tell. And what else? Remedy for
Polyps.
polyps. So polyp is a condition where the sinuses get blocked, and then there starts certain fluid filled collections forming, and then polyps are certain extra growths within the sinus which comes out when it's beyond the sinuses and blocks the nose and all that. So polyp, the only remedy is visit an ENT doctor. You'll have to take medications, and depending on the intensity, we would advise a CT scan and look for where all it's gone, and probably advise any intervention if required. So polyps, no home remedies. Please take advice.
Is it advisable to put cotton in your ears?
Routinely, is it a routine or?
The question says during night hours.
No, absolutely not. See, one thing I'll tell you, once, your ears need the air. See, many times if you're in a high humidity area, you tend to increase the moisture in your air and you can get fungus, especially if it is definitely not. And when you loud sounds, cotton may not help, but it's comfortable. Many use when suddenly loud sounds come, they tend to close and all. But routinely, no, unless the patient has had a recent ear operation, then we tell them put the cotton while you have a bath, and that cotton should be rubbed with a little bit of oil or Vaseline so that the water doesn't soak in. Other times, leave it open. The air is good for the ear to heal. And also if the patient has a perforation and discharging ear, or perforation is just healing, yes, when they take a bath or swimming time, but not a normal person with a normal tympanic membrane. No.
Another open question, Dr. Mary, Dr. Nadia. How do we stop children from breathing through the mouth?
Actually, many a time, children started breathing through the mouth, there's some problem, because neonates, especially, and children are all, especially newborns, are all obligate nasal breathers. So obviously the children may have a little, most of the time, like Nadia said, it's the adenoids which has enlarged. But, maybe I feel if it is enlarged enough and the patient has significant mouth breathing, or we look at the child and see his palate is elevated, his nose is pinched out, and his teeth are all crowded, we know the adenoids is significantly enlarged. Then probably it needs intervention. But if the child is having nose breathing as well as sneezing and recurrent nasal discharge, it could be an allergic element in addition. So it has to be a doctor, a ENT who evaluates that. Then there is a role where they give trial of nasal spray if the child is about 2 years of age. The others have anything more to add? Nadia and Preeti?
Ma'am has answered it.
If you can speak about deficiencies, there are questions about, does deficiency cause mouth ulcer? Does deficiency cause dizziness, vitamin deficiencies, mineral deficiencies? Again, open question. I will leave it to you all to decide who would like to speak about it.
Can I take that?
Please.
In general, see, deficiencies, healthy lifestyle constitute both your diet as well as your exercise. It's needed for your general health in whatever aspects. So when you talk about balance in particular, especially if you are a pure vegetarian and you don't touch any of the other poultry or milk or eggs, you might have a little bit of B complex vitamin deficiencies, especially B12. So that is something which we ask to supplement. And it is not only with your diet alone. Sometimes, as you grow older, your absorption due to some intestinal problems or some abdominal problems, or just the plain aging factors, your absorption from your food, all these necessary nutrient absorption from your food may be delayed or maybe interrupted. So even though you are taking a proper diet, the body may not get enough nutrients from that. So that is the time then we start to supplement. And regarding from the other vitamins or trace elements that is important, especially in alcoholics, the people who will have thiamine deficiencies, so that can produce problems. So you have an alcoholic patient coming in with a balance issues. The first thing that we would supplement would probably be a intravenous thiamine. And especially when I was just talking about migraines and other vascular migraines, there is a lot of interest coming up with magnesium supplements. In fact, recently when I was on a drive in an Uber, when the driver actually told me, I went to a hospital, my child had migraine, was only 6 years old. They asked me to take medicine. But then my neighbor told me, take the Amway product. See, I'm not in a way promoting Amway, but then take a magnesium supplement. And my child took it for 6 months and I am better. So there are people who vouch for magnesium, but then it has got its own problems also, diarrhea and all this stuff. But we do give magnesium supplements. So these are some of the dietary factors which might help with your balance per se in general.
But can I add this about
Yes.
vitamin deficiency? I think Nadia did say we give vitamin C. Many times when the mom comes and says, my child has cough and cold very frequently, I tend to ask what is their diet. And most often they say he doesn't take any juices, it's Pepsi or Coca-Cola, one of those. And it is a true fact. You know, if you read history, vitamin C deficiency helps our surface mucosa to heal. There's a story very famous during ancient maritime, within the sea voyages, how those sailors, many of them developed scurvy and died. So those are very, very important. That is why Nadia keeps saying we give vitamin C. I have seen it does make a difference. And like Preeti said, these days, I mean, I see many patients who come say they have burning in the mouth, and sometimes even burning while they swallow, but no difficulty in swallowing. We notice when we do, they have significant vitamin B12 deficiency. And I'm sure Nadia will also say about it. We have picked up a lot of deficiencies. I don't know. Obviously, it's something of a lifestyle modification and dietary. Possible all they can cause, and generally should not be missed out because it can be replaced.
I'd just like to add on 2 more nutrients, riboflavin. It is very good actually for your oral mucosa regeneration, especially in aphthous ulcers and all those things. And another thing, and it is also used in migraines also, especially in a higher doses than we give for regular aphthous ulcers. And there is a lot of interest in vitamin D, and people are all aware of vitamin D association with a lot of balance as well as problems. But again, here I would like to put a word of caution. Vitamin D is something which is stored in the body also. So there is a lot of over intake of vitamin D, which it can lead to toxicities also. So you should be careful while taking over-the-counter vitamin D supplementations. Always have your vitamin D level checked, because of recent we find people coming with vitamin D levels more than 70 and 80. So too much of anything is also bad. So when you're taking supplements, make sure those blood levels, some of them don't get accumulated in the body, but there are some which get accumulated in the body. So those have to be used with caution.
Thank you. I think we have time for 2 more quick questions. There is one, perhaps Dr. Mary, you can address this. What are the causes for the narrowing of the ear canal?
When sometimes people are born with narrowing, there are also situations when constant irritation of the external canal can cause otitis, recurrent external infection, and the skin gets thickened and it narrows. So it can be congenital or acquired. Sometimes after some particular surgery, the canal is repaired, and especially when for discharging ears, some surgery done, child is young and the child grows and the ear canal does not go as well, it can occur. So some people do have narrow canals, but if it's not symptomatic or only wax collection, we tell them once in 6 months, put the drops for 2 days, come in, we will clean it for you. So it is not a life-threatening situation.
Perfect. And I think this is a good kind of note to take the last question on. We have a question that says, should we undergo periodic ENT checkups just like we do periodic eye and dental? And if so, how frequently should we come in?
About hearing, I can say that
Actually, why don't all 3 of you answer this for your specialities?
Preeti, you want to say about hearing, the groups that...
Yeah, I guess, there is no particular need for a periodic checkup, I would say. But if you definitely have a problem, I think people surely come to us. If they have a hearing problem, if they have a balance problem, if they cannot smell, if they cannot breathe. So I guess, it's a compulsion that brings the patients to us rather than a regular checkup. Also, that's how I would feel. I'd like to get the feedback from the other speakers as well.
I think if a person is a diabetic and has episodes of uncontrolled session or otherwise also, is good to have hearing assessment, and at least the start. And if you find a mild reduction sometime, I actually tell them come after 6 months. That's for an adult. But for a child, I think many times it's forgotten. There is a hearing screening for new children now for everyone. But in the process in our country, we are sometimes missing out some children, and some children happen to be the children who are premature, who had antibiotics in infancy, who has neonatal admissions. I think those babies have to have periodic checkup till they are about. In fact, they say that they can have hearing loss even later in life. So those are one particular must have a periodic. They say once in a year for the first 5 years, once in 3 years for the next 5, and once in 5 years. For those group, I can say.
I would like to second whatever ma'am and Dr. Preeti said. Only hearing, maybe above 60 years, we anticipate some kind of age-related hearing loss. So maybe once a year and on a routine. Otherwise, unless you have a concern, you may not really need to come on a regular basis unless, like what everybody else mentioned.
I would just like to add on to what Nadia said, about 60 years, we are always concerned about the hearing loss in the youngsters. But, when you have a 75-year-old dad in the house or mom in the house who cannot hear anything, please don't push them to the back of the house. We have solutions for them. As much as we do for deaf children, we have cochlear implants and adult implants. Especially, we had a patient who said, all I want to hear is my grandchild's voice. So there are so many people with, there are people, we tend to be more concerned about our children's illness rather than our parents' illness. But again, all of us are advancing towards that end. So, and we do have options. So it is not like, okay, it is just part of aging. You cannot hear. Okay, now you sit. It's not like that. There are a lot of options, and there are surgeries, and there are technological advancements which can help in their hearing and to be a useful member in the society. So that part of hearing also.
One more thing I'll add, if you have a child who comes with recurrent voice changes and small nodules in the voice, we always ask, do you have in your grandparents or anyone in the house who is hard of hearing? Or then they say, yeah, my dad. So you see, you may have to treat the dad same time as the child, the granddad the same time, like Preeti says. Yeah, we have had when you don't take it seriously, but definitely need to.
Perfect. Thank you all so much. We have many questions that have come in. Unfortunately, for paucity of time, we haven't been able to address all of them. Also, just a note for our audience, I'm taking the liberty on behalf of the doctors. There have been questions that are very case specific, that have left case histories in the comments, etc. Perhaps an open webinar may not be the best platform to give case specific advice, and therefore we haven't addressed those. We have tried as far as possible to answer general questions that affect each of our lives. I think we've heard from the doctors that in case of any kind of specific history or recurring issues, please go see an ENT. But otherwise, general health markers, general lifestyle, taking care of hygiene, health, wellness, lifestyle are probably great tips for overall health. On that note, thank you so much, Dr. Mary, Dr. Nadia, Dr. Preeti. It was a very, very enlightening session on a range of subjects that are both medical, but also so everyday that I think all of us have a deep interest in it. Thank you for spending your Sunday morning with us, and thank you very much to our audience as well.
Thank you very much for giving us the opportunity.
True that.
As well listening to. Thank you. Thank you for the audience for your patient listening.
So, thank you, ma'am. Thank you for everything.
Thank you. Yashashwini. If I have
Thank you so much.
pronounced that correctly. Okay, have
bye.
and good days ahead.
Yes, to all of us. Bye.
Thank you.
Really good job from Yashaswini's side also, like really coordinating.
know.
Thank you.
really-
Priya, maybe we can stop recording this side of things.
I know. I was very apprehensive, to tell you the truth.
No, I understand why.
She's like the captain.
Sorry, I couldn't hear you past the recording. Sorry?
she was like the captain of a ship.
Oh
She
goodness, no.
really
It is
encouraged
by
everyone.
far one of the first few webinars where I didn't have to send any time cues because all of you were completely exactly on time. So thank you
Thank
very
you
much.
very much. We were very conscious.
You're all women,
No,
ladies, on
I
time.
know, correct. It's not a coincidence.
We were, but and I thought
I think we had some fantastic questions also. There
think-
were there were a few others that might have been nice to address, but it started slow but came
Yeah.
fast
wonderful
and furious after
participation from
that.
the crowd, I should say. I mean, lot of questions pending.
Lots of a
Oh.
fair few. I think about a dozen of them were very age this much, this problem. What would you like us to do type questions.